Hello everyone, this is Manpreet Kaur, Assistant Professor of Psychology, Department of Humanities and Social Science, RIMT University. Our topic for discussion is schizophrenia. So, we will discuss schizophrenia, symptoms of schizophrenia, then types of schizophrenia, its etiology, and then yes. So, schizophrenia is the mental disorder. Literally means the literal means of schizophrenia is fragmented mind, that is the mind is divided into very small pieces. The literal meaning of schizophrenia is this. So, schizophrenia is one of the most complex, chronic and challenging of psychiatric disorders that affects how a person thinks, feels and behaves. So, that means schizophrenia, when we talk, it is a complex disorder, complex of all the mental disorders. That means it is very hard to deal or manage with this disorder or the symptoms of this disorder. It is basically a neurodevelopmental disorder that leads to the disturbance or distorted mental condition. So, it represents a heterogeneous syndrome of disorganized thoughts, hallucinations and impaired psychosocial functioning. So, when we talk about the major disturbances in schizophrenia, that is the hallucinations, then delusions and disordered thinking and cognition are the most prominent symptoms of schizophrenia. The major disturbances are there in thought process, then emotions, or we can say emotional expression of the person and the behavior of the person. So, distorted thinking could be exhibited in the form of illogical ideas. Ideas are not related logically. There is no association between their ideas. What they do, they jump from one idea to another idea. Their faulty perception is there. Misinterpretation of whatever they perceive, and the disturbance in their attention is also there. So, disturbance in emotions could be exhibited with the through this lack of emotional expressiveness, that is blunt and effect. So, they show inappropriate emotions or they show flat emotions, that means no expression of emotions. Then there are disturbances in their movement or behavior. So, they possess distorted behavior, disturbed behavior, disabled appearance is there. So, it can, as I said, it is a mental disorder that can lead to the disruption in the interpersonal relationships of the person. It diminishes the person's capacity to work or live independently. So, it impairs the person's normal functioning. So, next is significantly increased rates of suicides and death are there. People with schizophrenia, it is very hard for them to deal with such symptoms like hallucinations or delusions, having distorted beliefs or having or hearing some voices that are not actually present. It is very hard for them to deal with these situations. So, because of all these conditions, there is high rates of suicide and death in the patients of schizophrenia. So, if we talk about the prevalence of schizophrenia, lifetime prevalence is 1%. It is not that it's a rare disorder. So, affects men slightly more often than women. So, this disorder is prevalent more among men than women. So, its onset typically starts in late adolescence, that is it starts after 15 or 16 years of age, or it can start during early adulthood as well, that is early 20s we can say. So, men diagnosed a little earlier than women. So, that means the symptoms of this disorder exhibit in women in 20s, like 21 or 22, these age years, but in men the symptoms start appearing a little earlier, that is during the age of 15, 16. So, it's a genetic, genes play a major role in the development of this disorder. 8% in the siblings of affected subjects. So, siblings of the affected subjects are at risk of developing this disorder. So, if one parent is affected by this disorder, there is 12% of chances in the offspring or their children to develop this disorder. So, if both the parents are affected by this disorder, then 40% of chances are there that their child will develop this disorder. So, if we talk about the DSM criteria for schizophrenia, okay. So, 2 or more of these symptoms for at least 1 month, for the period of 1 month should be present. One symptom should be either 1, 2 or 3, that is, the first one is delusion, the second one is hallucinations, and the third one is disorganized speech. So, at least one of the symptoms should be delusions or hallucination or disorganized speech. Except all these three symptoms, there could be presence of disorganized behavior or catatonic behavior. Then the negative symptoms could be there, like diminished motivation in the person or emotional expression. So, we will discuss all of these symptoms one by one. So, functioning in their occupation, their relationships or self care declined since the onset of this disorder. So, signs of disorder for at least 6 months should be present. If during prodromal or residual phase, negative, that means the 1 month of severity of these symptoms, all these 5 symptoms, among all the 5 symptoms, 2 or more of the symptoms should be present for at least 1 month. But before that 1 month, there should be a period of 6 months before that 1 month, in which the person shows the negative symptoms only. So, overall 6 months of the symptoms should be present to diagnose a person with schizophrenia. Okay. So, when we can categorize the symptom of schizophrenia into 3 categories, that are positive symptoms of schizophrenia, negative symptoms of schizophrenia, and then are the disorganized symptoms of schizophrenia. So, under positive symptoms, there comes delusions and hallucinations, and negative symptoms, there is avolition, alogia, anhedonia, blunted affect, and sociality. And in disorganized symptoms, disorganized behavior and disorganized speech is there. Why these symptoms are called positive and negative? That is, in positive symptoms, there is excess of something in that person. That is, the person is having something in excess, delusions, the faulty thinking process, that is the presence of something, right. So, if hallucinations are there, that is, person is hearing something, or person is feeling something, or person is perceiving something that is actually not present, but person is experiencing that thing in excess. So, that is why delusion and hallucinations are there and are called positive symptoms. When we call negative symptom, that means there is lack of something, right. So, that is like blunted affect, the person is not expressing his or her emotions, that means the person is lacking something. So, that is why these symptoms are called negative symptoms. So, okay. Positive symptoms, that is behavioral excesses and distortion. So, first under positive symptoms comes delusions, that are firmly held beliefs. It is basically the disturbance in their thought content. So, and those thoughts or their false beliefs are contrary to the reality, or the contrary to their social norms or cultures, or resistant to disconfirming evidences. They are so they believe so much in their false beliefs, they trust so much that they resist to disconfirm the evidences. Even if evidences are present against their thoughts, still they are not ready to accept this, that their thoughts are false. So, disturbance in the content of thought is there. So there are some types of delusions, that is outside control. This is the belief that someone from outside is controlling one's thought. So thought broadcasting means somebody in the outside world is broadcasting my thoughts to others. So thought insertion is someone is putting the thoughts into my mind. So the thought withdrawal is someone in the outside world is withdrawing the thoughts from my mind. So these are the main types of delusions. And then are the hallucinations. These are the sensory experiences in the absence of sensory stimulation, that is, no sensory stimulation in the environment is present, but still the person is experiencing these sensations. Okay, so types of hallucinations could be auditory, visual. So auditory hallucinations are most commonly present. 74% of the persons suffering from schizophrenia suffer from auditory hallucinations. These are basically hearing voices. Auditory hallucination is hearing voices that are not heard by others. So yes, negative symptoms, under this comes avolition, that is the lack of interest. The person since the onset of this the symptoms of schizophrenia, person does not show any interest in the activities. So there is a lack of interest. Next is the sociality, that is the inability to form close relationships, or person is not able to form a relationship or maintain his or her relationship, because person is so much occupied with his positive symptoms of schizophrenia, that are hallucinations or delusions. So anhedonia is another negative symptom, that is inability to experience pleasure in any kind of activity. So blunted affect is there, that is exhibits little or no effect in the face or voice, that is the person doesn't express his or her emotions. So alogia is the last one, that is the reduction in speech. So disorganized symptoms could be disorganized speech. It's also called formal thought disorder. Incoherence, their speech is not coherent at all. There is inability to organize ideas. So loose associations is there. You can clearly notice the lack of association in their ideas or in their speech. They jump from one word, they'll say one sentence, their another sentence will be quite opposite to their previous sentence. This is how they exhibit loosening of their association in their speech. So that is, yes, there is difficulty sticking to one topic. Okay, disorganized behavior is there, that this could be exhibited through the odd and peculiar behavior, that is silliness, agitation, or unusual dress up, like wearing heavy clothes in hot weather. So movement symptom, they sometimes lack movement in their body, that is this condition is called catatonia, that is motor abnormality. Motor abnormalities are there. This is a condition, this is not a common symptom that is present in all the people with schizophrenia, but this is one of the conditions. Some people with schizophrenia also exhibit this state, that is catatonia. So that is repetitive complex gestures, usually of fingers or hand. They'll make a typical movement with their fingers or their hands, and they can remain in one position without moving for several hours, like for 8-9 hours they remain in that condition only. So yes, catatonic immobility, yes, again that is the thing, that they maintain unusual posture for longer period of time. For example, stand on one leg. Okay, I'll show you that, like this. So the person with the catatonic symptom or the person with catatonic immobility could remain in such condition for several hours, like for many hours, like 5-6 hours, sometimes for the whole day, the person remain in this state. So this is called catatonic behavior. Okay. So genes play a very important role, as I already said. There is genetically heterogeneous. Okay, so this disorder is not caused by any single genes. There is a mixture of genes that could lead to the development of this disorder. Yes, so people who are already having their relatives or the person who is suffering from schizophrenia, there is risk in the relatives of that person or the children of that person to develop schizophrenia. The risk is higher than the normal population. So, okay, a dopamine theory to explain schizophrenia, according to this theory, there is this disorder occurs due to the excess of level of dopamine in the person's body and brain. So, another cause of schizophrenia is enlarged ventricles, that is loss of their brain cells. So, this is exhibited that their ventricles are enlarged. This is exhibited by their poor performance on the cognitive tests, their poor adjustment and poor response to the treatment. So, you can see the ventricles of the person with schizophrenia. Healthy brain, in the healthy brain you can see in the middle of the brain the ventricles are small, but in the person's brain, schizophrenia's brain, the ventricles are large. So, this is also a cause of schizophrenia. So, another are the prenatal exposures, that is viral infections. Viral infections could be one of the causes. Another is the rhesus incompatibility between the mother and the infant. So, pregnancy complications or any kind of birth complications could lead to schizophrenia. Any early nutritional deficiency in the mother during pregnancy and then the infant after the birth could lead to schizophrenia, and maternal stress is also linked to the development of schizophrenia. Okay, so this is the diathesis stress model of schizophrenia. That is, the person, suppose let us say there is a person who is already at risk of developing schizophrenia because of his genetical factors, because of his genetical predisposition, and again when parental prenatal or perinatal events occur, like mother engage in any kind of drugs consumption or any viral or mother or father exposed to any kind of viral infections. So, these are called the complications during prenatal and perinatal period. This leads to the brain vulnerability, that person's brain gets vulnerable to develop schizophrenia. And then in the person's life, when stress comes, when the person confronts with stress, and also when there is automatic natural developmental maturation processes goes on, this leads to the psychosis. Psychosis means untouched with reality. So, schizophrenia actually is a psychotic disorder. So, this is how a schizophrenia or psychosis develops in a person.